full agenda this afternoon. I'm Stuart McWhorter. I'm the CEO of the Entrepreneur Center here in Nashville. So welcome to the EC and this awesome space that we're so privileged to have and utilize. We do lots of these events and always love hosting groups and people locally and those that aren't local. And that's one of the things I'm curious about in talking to Russ, that there's a pretty geographically diverse group here. So I'm just curious, for those of you that are, maybe I'll just ask for the locals, who in the room is from Nashville or Middle Tennessee? And then, okay, who's from Atlanta or the Georgia region? Because I know there's a few, yeah. Anybody outside of those two locations? We got some Florida people here, I know. Where else? Los Angeles. Okay, great. So we cover both ends. Great. Well, welcome. My job today is just to do a simple welcome and introduction, and really I might go back to a conversation that Russ and I had about a year ago now about how the region could continue to collaborate around healthcare and innovation. And you know, the view that I've had since being here is really kind of from the inside out. You know, our role at the Entrepreneur Center is we really help promote entrepreneurship and small business, not only for Nashville, but really for the contiguous counties around Davidson County. We're part of a network, a statewide network called Launch Tennessee. Charlie Brock, who will be here later to speak to you, runs Launch Tennessee, and that is an organization that's under the Department of Economic Development of the state of Tennessee. We're one of 7 tech hubs, and our footprint is essentially Middle Tennessee. So our obligation not only is to serve this county and Nashville, but we really are doing a lot of outreach to other counties and communities in this region. Outside of that, we are also, the Entrepreneur Center is also part of Google for Entrepreneurs Tech Hubs. We're one of 9 in North America and one of about 30, I believe, in around the world, sorry. So what that means to us is that we have the ability to collaborate with Google out in San Francisco, and then also collaborate with the many other tech hubs that are part of the Google for Entrepreneurs in terms of best practices, programs that they're running, how to integrate with ideas along different industry verticals. We view ourselves as one of just a handful that focus in healthcare, primarily because of being here in Nashville and all of the great assets that exist here. And so we tie in to that. But there are some other tech hubs in the Southeast that we talk to probably more frequently than others, because we do see the value in connecting. And if it's something that we aren't doing here, sort of in the 4 walls of the Entrepreneur Center, we definitely want to know what other tech hubs are doing, what programs that they have, the people that are engaging with the entrepreneurs that are, in most cases, volunteers that are entrepreneurs or have been entrepreneurs that understand how hard it is, the commitment that you have to make, and the sacrifices that you have to make in order to just start and successfully run a business. It's one thing to start one, but you have to actually make it work. And there has to be a reason for it. And it has to solve problems and hopefully touch a pain point that the system, in our case, in the context of today, that the healthcare system is struggling with. We like to think in Nashville that we have lots of great organizations and people that can think about solving those problems. What typically happens, particularly on the corporate side, is that they're all just busy running their businesses and putting out fires. They're not thinking about innovation every day like small business and entrepreneurs do. So the key is to connect that, and how can we do that in a effective way. So today is a great example of bringing people together to talk about very important topics to the industry. And it takes a commitment, it takes an ongoing dialogue, and I think what Russ and Health Connect is doing is trying to continue to keep the conversation moving and bring people together and find ways to collaborate and partner, and where we always like to say around here, 1 and 1 makes 4 or 5. So Congratulations, Russ, for getting everybody together. I'm glad we're a part of it and can at least participate in a small way. And so with that, I will hand it over to Russ, introduce Russ Lipari, who's the CEO of Health Connect South, and we'll let you take it from here. Thanks.
Thank you so much. Appreciate it. This is awesome, and thank you, Stuart, so much for your hospitality and for your entire staff at the EC. They have been wonderful to work with, as has the larger Nashville community. We have felt a very warm embrace, and thank you for that. Nashville is awesome. And Atlanta is awesome. And Research Triangle is awesome. And we've got some great things going on in Alabama and Florida, and we are the only thing that we know of trying to bring all of them together. So thank you all for being part of that. With that, however, if you thought you came here to sit and lounge, let me be the bearer of bad news. This is definitely time to work. Work toward promoting collaborations, work toward understanding more of the rich array of health assets that we have in the Southeast, and discovery to see what's here and what they need. And with that, it's the very basic premise upon which Health Connect South has been built. If we can bring together the right innovators, the right decision makers, and the next generation of health leaders together to talk about those very simple things. What do you do, and what do you need? That's it. Because after the need has been made apparent, everybody knows what to do. You know where to help, you know how you can help, and you know how you can leverage that. And so as a nonprofit, our mission is to serve as a regional platform for health collaboration. We do that in 3 ways. 1, bringing people together face-to-face. 2, we have a weekly radio show that we've done now for about a year, which has gone very well, that we look forward to continuing. And 3, we are launching an online platform to do that. We beta launched that at our conference in September. We'll have another large conference in September. Last year our attendance was around 600 and had some wonderful folks throughout the Southeast, and we're very hopeful that you can come. We have enjoyed a great high-level speakers, but also people that you're like, I don't know you, what do you do? And you're like, wow, that's amazing. This is incredible. And many of those people are here today. I want to say thank you, especially to our sponsors that have been so wonderful in believing in a vision and a mission before there was anything here. Several of them are in the room. And so thank all of you, both our advisory board members that are here and our board of directors that have come to make this mission possible. So what is Health Connect South? Nothing like practical application. So no joke, please get up, get out your business card, and go meet somebody that you haven't met. We're going to take 3 minutes to do that, and then I will come right back. Not someone that you know, no joke. Timed event.